Senator Smith.
Thank you, Madam Chair, Ranking Member Marshall. Dr. Taylor, I want to just turn to you quickly. Could you quickly respond to this myth of post-abortion trauma and suicidal thoughts? Maybe also just quickly address some of the systemic causes for the vast disparities in maternal mortality in this country.
Sure, absolutely. Based on how I talk about maternal mortality, I center Black women in the work that I do. And, the maternal health crisis is the root of that is racism. How we see structural racism not only show up in the healthcare system, but I think also broader society. We know that racism, particularly the experience of it for Black people, causes us to, be more susceptible to disease, mental health challenges, in addition to physical health challenges. And so we do see that show up sometimes in the context of, the care that pregnant women may be undergoing. I think a part of it is too, Black women also have reported experiencing not being listened to by their healthcare providers. So when they express pain or discomfort in some of their exchanges with physicians, that is sometimes ignored. We even saw Serena Williams share her own story of what happened to her and not being listened to shortly after having her daughter. And so to me, those are some of the root causes of the maternal mortality crisis. And look, I recognize that, pregnancy in and of itself, no matter how you decide to move forward, that is a decision based on the woman and her family in consultation with her physician. And that can spark some challenges for her mentally because it's a difficult decision. But I don't think that it's true to say that, for the most part, women who stand firm in their decision to have abortion are regretting that or, experiencing mental health challenges because of that.
It's fundamentally a question of who has the decision, and the ability to control your own decisions in your own life is really what this is about, it seems to me. I'd like to turn to you, Dr. Brandy, and turn to the question of medication abortion. So medication abortion has been a safe and effective way of terminating a pregnancy in the first 10 weeks for nearly 20 years. A provider can safely prescribe medication abortion through telehealth in most cases, and it can be delivered through the mail also. Slightly over half of abortions in this country are done with medication now. But now that the Supreme Court has overturned Roe, this medication will be a crucial access point for many women. We cannot allow Republican politicians to spread misinformation about this medication, which is happening, or to erect unnecessary hurdles to stop women from access. So, Dr. Brandy, can you just tell us, is medication abortion safe and effective for women to use in the first 10 weeks of pregnancy?
Senator, that's an easy one. Absolutely.
Thank you. And can you just walk through a little bit of the process for how providers determine whether medication abortion is effective per person?
Sure. When I see a patient that is seeking abortion, I always go through all the options and talk about risks and benefits. Particularly around medication abortion, there are very rare contraindications to receiving medication abortion, but generally it is incredibly safe. It is anywhere between 95 and 99% effective in ending a pregnancy up to 10 weeks. And it is something that requires very few interventions from the healthcare system. Many people can determine based on their last menstrual period when they became pregnant. And based on that and their symptoms, patients can be provided this medication over the phone via telehealth.
So it's not medically necessary for a person to be prescribed this medication by a physician in an office?
Not in an office setting, no.
Yeah, thank you. So I want to just be clear about this. Medication abortion cannot alone undo the damage done by Republican politicians who are taking away women's freedom. And today we know that there are states that are undermining the capacity of people to access medication abortion, but it is an important access point to protect access where we can, and to actively fight this misinformation, I think, is an important thing for us to do here. I am sorry that I am out of time here, but I want to just follow up briefly on the line of questions that Senator Hassan asked, which was to really to illustrate The chaos that is ensuing around this country as a result of this extremist Supreme Court decision to take away this fundamental freedom of people, and what we see from Republican lawmakers determined to control the decisions that women want to make based on where you live, the right and freedom of women to get an abortion, to manage their miscarriages, to treat an ectopic pregnancy is now severely compromised. This legal chaos which has ensued means that your doctor may not even believe that they have the autonomy to decide and to make and to practice based on what their best medical information is and what they believe is best for their patient. So let's be clear. Let's be clear. Republicans are responsible for this chaos. They created this healthcare crisis because they believe they know better than women whose lives and stories they will never know. They believe that they know better. They believe that they should control. That's what we are now faced with. That's what we are now working to fix. We will not stop working until women's freedom can be exercised equally in all parts of this country. Thank you, Madam Chair.